Hi everybody, this is Dr. Britt Talley Daniel MD, and I'm a neurologist and headache doctor. Today I'm making a movie on for YouTube. New drug that just came out for migraine prevention. It's called Vyepti eptinezumab. It's for migraine prevention. So migraine is a genetic problem affecting 12% of the world's population. 20% of women and 6% of men have migraine. And for women, migraine is the most common health problem they have, occurring more frequently than arthritis, hypertension, or diabetes. Migraine is also one of the most painful conditions in the world, and if you talk about painful conditions, those are childbirth, a kidney stone, and migraine headache. The International Classification of Headache has said that chronic migraine is 15 or more headache days a month, 8 of which have migraine features. And the migraine features are one-sided, moderate to severe, throbbing, sensitivity to light and sound, and nausea and vomiting. Episodic migraine is 15 or less, is less than 15 headaches per month. So, Vyepti, or eptinezumab, for prevention of migraine. The FDA has approved this drug as the only infusion, that means IV treatment for migraine prevention. It's been approved for both episodic and chronic migraine. It's the first intravenous monoclonal antibody inhibitor of calcitonin gene-related peptide, which is abbreviated as CGRP, approved by the FDA. So what's the dosing of this drug? Well, it comes in 100 milligrams every 3 months, or some persons need a higher dose, like 300 milligrams every 3 months. The dosing for hepatic and renal impairment is not defined, and pediatric dosing is not available or applicable for this drug. What's the onset of activity? In patients with chronic migraine, eptinezumab 100 and 200 and 300 milligrams was associated with significant reduction in migraine days from the day after IV administration through week 12. They made a big point of this when the drug was brought out, that it works faster than other drugs, working from day one. The drug was well tolerated and demonstrated an acceptable safety profile. Well, what about contraindications or cautions? The only problem there is hypersensitivity to drug or class, which is rare. So people can't take it, they're hypersensitive, they just can't use it. Adverse reactions. Participants in the clinical trial who received at least one dose of eptinezumab had a low rate of adverse events, which most commonly were nasopharyngitis and hypersensitivity. Only 1.9% of enrolled participants in the study discontinued treatment because of adverse events, which is pretty good, so it was well tolerated. Serious reactions are the hypersensitivity reaction, as I mentioned. Common reactions were nasopharyngitis, hypersensitivity reaction, angioedema, urticaria, facial flushing, and rash. Drug interactions, just like all the CGRP drugs, they don't have any drug reactions with anything, and these drugs don't have any problem with any other drug. And most drugs in use in medicine have 10 to 20 drugs you can't take with them, but this drug has none. What about pregnancy, lactation? Well, caution is advised during pregnancy or while breastfeeding, as there's no human data available. Pharmacology. The metabolism is through proteolytic degradation, and there's no interaction with the CP450 allele. Excretion is unknown. The half-life is 27 days, so it's again one of these long-acting drugs. You can give it over a period of 3 months, that's okay. The mechanism of action is blocking CGRP, and it's a monoclonal antibody. FDA approval was based upon data from the PROMISE 1 clinical data for episodic, then another one for chronic migraine. Treatment benefit was observed for both doses, 100 and 300, as early as day 1 after infusion. The treatment benefits were sustained over a 6-month period with 2 quarterly doses. I have some comments from persons writing about this drug. This is Dr. Peter Goadsby, a professor of neurology at King's College London and the University of California, San Francisco, and he said, the data showed that many patients with chronic migraine can achieve reduction in migraine days of at least 75% and experience a sustained migraine improvement through 6 months. That is pretty good, which is clinically meaningful to both physicians and patients. Vyepti is a valuable addition to the treatment of migraine, which can help reduce the burden of this serious disease. Now, Dr. Gosby is a really famous headache guy who's doing research now. Dr. Deborah Dunshire, President and Chief Executive Officer of Lundbeck, the pharmaceutical company that brought the drug out, stated, with the approval of Vyepti, I'm pleased to say that we're now able to offer a new intravenous therapy that achieves the key treatment goal of preventing migraine over time, while also delivering on the need for early dosing efficacy. The clinical problem is first is demonstrate this early benefit. I want to make a comment myself about this. Now, this drug is going to be given IV, and so it's going to have to be given at an outpatient infusion unit or a doctor's office who's set up to do that, making it different from the ease of personal subcutaneous administration by persons of the other three CGRP drugs which are available, which are Ajovy, Aimovig, and Emgality. And those drugs have worked well, and it's not known of any comparison studies between the drugs as which is going to be the best one. I think I would probably start a patient on subcutaneous before using this drug just because it's an IV infusion. We'll have to see how that goes. Is this stronger than the other drugs? No one knows. There are no studies that have been done. So, those are my comments on this drug. It just came out at the end of March 2020. We don't really know a whole lot about it. There are no other reviews that I've seen. That'll come with time. Please go to my webpage at www.drmigraine.com, and I have there's a table there for how I got through with the FDA, and it's written down in more detail. Please click subscribe down there so we can follow each other, and God bless all you persons who have migraine. I will see you again on another talk.